Hello and welcome to this session on programming for complex needs in in-home care. Before we begin, I'd like to thank you for attending and acknowledge the traditional custodians of the land we meet on and pay my respects to elders past, present and emerging and to all Indigenous people present. Today we're going to look at a brief overview of programming and planning. We're going to look at working with families, carers and community to support disabilities. We'll look at inclusion strategies and strength-based practices. We will capture teachable moments and planning activities for different needs such as physical, sensory, cognitive, attention deficit hyperactivity disorder, and speech and language disorders. So let's first start with having a look at the programming skills. So you are probably already doing many important skills that make up programming and documentation. This slide shows skills that in-home care educators do as part of their day. You already use your knowledge of the child development to inform your environment and your practices. You use information that you have about the child and their family. You use resources and plan activities that support the child's well-being and learning. You also refer to the early years learning framework principles, practices, and outcomes when planning your program. Think about how you have planned your day or your week. How do you document your program and your observations? What activities do you do on a regular basis? Educators are deliberate and purposeful in their planning and programming, ensuring all children's interests and needs are considered. So let's have a look now at the programming cycle. Let's start at play and intentional teaching. So we know that children engage in learning experiences through play in different areas of interest as well as planned experiences. These planned experiences are part of our intentional teaching. From this, we then observe children. So observations are taken of individuals during a planned or spontaneous learning experience, and we can also observe groups. We then record and interpret. So record and interpret observations and link them to the EYLET. Identify the learning that's going on and the outcomes achieved or things that children are working towards. We then need to plan. So we plan for future experiences to extend children's learning based on our observations. And lastly, we set up the environment. So educators set up indoor and outdoor environments that are based on their plan in order to foster children's learning and development. This then takes us back to play and intentional teaching, and this cycle continues. When you commence care of a child in in-home care, if you feel you need additional support, you can consult your in-home care support agency, your service provider, or ask the family permission to access information provided by other professionals working with the child. For example, you may ask to seek strategies provided by the child's health professional, such as an occupational therapist, to see if you can incorporate any of their strategies into your program. Other sources of information include your support agency, the child's family, and other professionals, such as physios, pediatrics, or OTs. Some other types of information you could gather include learning and play needs of that child, how to use specialised equipment such as hearing devices or prosthetic limbs, how to appropriately respond to specific behaviours, and also specific care requirements. So if the child has a cognitive developmental delay, they may be behind in toileting and may need additional assistance. An imperative part of being an in-home care educator is working with families. So when we do work with families, make sure we set goals with the parents or carers. We need to provide them feedback through our observations. We need to provide opportunity for the parents or carers to input into the program. So gauge the parents' interest in this. Some parents or carers may be really enthusiastic and some may be reluctant. They may just want time out. Parents may already be overwhelmed by the people involved in the child's care and the advice given. Your family may also discover that there are unique requirements for resources. This might be equipment or facilities, and you should become familiar with their use. It's okay not to feel 100% confident or experienced straight away. Some educators lack knowledge or experience on some needs. This is where we really need to engage in cooperative communication and a collaborative approach. Observations can be a great tool for educators if they wish to address developmental concerns. So it might be that you pick up on concerns first, and this information that you document can be used to share this with other professionals. When we begin caring for a child with complex needs, keep in mind that the parents or carers may be well into their journey. They may already have diagnosis and they may already be working with healthcare professionals on a regular basis. As an educator, we must acknowledge parents as a wealth of knowledge that we can learn from. Most of the time, families will already have a great deal of information to share. Listen to this information and set common goals with the families for the child, which you can use to direct your program. So when working with families, keep in mind that an educator usually has long-term goals. They're quite objective in their approach. They're development focused. They have some professional networking and professional knowledge. With a parent, they really know the history of the child. They can be very emotionally invested. They're needs focused. They have the best knowledge of the child and a deep understanding. So these two together are a fantastic partnership. Always respect a family's right to confidentiality, as they do not have to share information about their child's needs, development or disabilities. But it's always best if they do so, as this will support your role as the educator. Let's also have a think now about how everyone is feeling. It's important when working as an in-home care educator to understand that everyone is on their own journey. So how may the parent or caregiver be feeling? They may be afraid of the educator's acceptance of their child. They may be grieving over the child's diagnosis or disability. They might be reluctant to share personal information or relieved to be receiving help and support. They could be unsure of others' ability to meet the child's individual needs, and they may be feeling an element of guilt asking others to care for their child. How might the child be feeling? They might be having difficulty participating in activities. They may have difficulty communicating their needs or become frustrated or distressed if they're misunderstood. They could be anxious about meeting someone new or self-conscious about their differences. How could you as the educator be feeling? You might be feeling nervous or inexperienced. You might be feeling anxious about your lack of knowledge or experience with the complex need. You could be feeling unsure of your place in someone else's home, or feeling hesitant introducing a child to new experiences. It's important that all those feelings exist, and it's perfectly normal. A great way to overcome many of these initial anxieties is to program for the child focusing on their abilities. Look at what they enjoy and what they're good at. This is what we refer to as strength-based practice. By starting your programming journey with strength-based practice, it can set a positive tone and encourage positive relationships. Focusing on strengths and abilities for children with additional needs is also a support factor for the child, the family, the children's service professionals, and other children and families involved. It's more relevant to focus on what the child with a disability can do rather than their weaknesses. Always keep this in mind when programming. Children's service professionals who practice a strength-based practice are more successful in planning and providing for future learning and development. So let's now have a look at some specific needs that children may have and how we can provide for these. All children should be accepted and welcomed as unique individuals. The focus should remain on their ability rather than what they cannot do. So these are some great approaches to take to focus on those abilities. So when we look at physical or motor disabilities, we can adapt learning activities in the following ways. We can provide tools that children with motor disabilities can use for grasping, holding, transferring, and releasing. We can be sure that objects are age appropriate. For example, a beanbag made from fabric is much more appropriate for a 5-year-old than a rattle or baby toy. Plan activities to encourage all children to move all body parts. Work with parents and specialists to choose special exercises for the child. We can add tabs to books to make it easier to turn pages and place tape on crayons to make it easier for children to grip. Provide paintbrushes with large knobs for holding, and consider buying scissors that open automatically when squeezed or scissors that do not require children to use finger holes. Provide spray bottles to practice the squeezing motion needed to use for scissors, so that's really focusing on fine motor skills. And keep items contained. So roll a ball inside a hula hoop placed on the floor, or play with blocks on a tray on the lid of a cardboard box. This just makes things more manageable and really promotes a child's self-esteem. When we look at sensory processing issues, we could provide materials of different textures such as Play-Doh, fabric, swatches, ribbon, corrugated cardboard and sandpaper to stimulate their sense of touch. We can engage in games and experiences that involve all of the children's senses as much as possible. When creating visual cues, use high contrasting colours such as black and white, and create textures using glitter, sand, and add scents to paints and Play-Doh to engage the child. Children with hearing impairments work well with close, quiet interactions. And if a child is tactile sensitive, you can still provide experiences such as painting by putting the paint under clear sheets of plastic or cling film, and then allow the child to move the paint around with their fingers without getting paint on their skin. So it's all about adapting these common experiences and provisions to better suit the needs of the child. If we look at cognitive delays or learning disabilities, we can ensure activities are age appropriate and relate to the child's interests, provide choices and let the child direct the play. Still allow for challenges, so find a nice balance so that the child feels a sense of achievement without being bored. When children feel success, they become more independent. Be aware of children's different learning styles. Break down tasks into simple steps, visual cue cards, and allow for longer uninterrupted play. This really gives children the opportunity to engage meaningfully in what you've provided them without feeling rushed. You may also find that you work with children with attention deficit hyperactivity disorder or ADHD. We can provide positive educator strategies such as encourage the child to do mindful breathing, mind-body connection activities. We can teach them to have realistic expectations of themselves and ask for help when needed. If you're reading a story and sounds from the outside capture their attention, Relate it back to the story to shift their focus back to where it's supposed to be. Allow them to play in natural open areas as much as possible. Use visual reminders to provide routine and structure. Provide hands-on learning experiences. Always get the child's attention first before giving an instruction. Keep instructions simple, short, and clear. Minimize visual distractions and noise, and shorten the task or break one task into smaller parts to be completed at different times. Provide closer supervision and support. For example, use hand signals to remind the child what they should be doing and stay in close proximity to the child. So once again, just adjusting your usual practice to meet these unique needs. The last area we'll look at is speech, language, and communication disorders. So books can be used in many ways to develop language and early literacy skills. Evidence show that children that have more exposure to books prior to schooling often find it develops early literacy skills. Be a good model, so speak clearly and slowly and face the child when speaking. If the child says a word or sentence incorrectly, rather than correct them or ask them to repeat it, just say the word or sentence back to them correctly to show you have understood. This way, your child always hears the correct version. This is how children learn language. Songs and rhymes, containing rhyme or rhythm, skills that help with speech and literacy development are also a great tool. Simple games with wooden blocks involving all sorts of language and play skills, such as turn-taking, joint focus, sharing, listening, attention, and observing. Another thing that we like to focus on is building independence with self-help skills. All children, including those with learning difficulties or developmental delays, can greatly benefit from learning self-help skills. These skills develop their autonomy and allow them to feel a great sense of achievement. It can assist in promoting their self-esteem, which in turn can build confidence in other areas of learning. Here are some ideas for self-help skills that children can participate in of all different ages. Educators can promote these all throughout the daily program and embrace these tasks as valuable teachable moments. So with 0 to 2-year-olds, we often think that it's too young to introduce self-help skills at this age, but there's certainly things that they can be doing. They can assist by throwing their own bib into the laundry hamper. They can clean their face and hands with a damp washcloth, put away their own shoes in a regular spot, begin exploring self-feeding with finger food or a child's spoon, and assist in packing away toys into a big basket. So at this age, the more exposure they have to self-help skills, the better it is to lay those foundations for when they become more capable. For 2 to 3-year-olds, they could self-serve a snack from a shared plate onto their own bowl or plate. They can comb or brush their hair, put rubbish in the bin, assist in dressing themselves, and practice wiping up spills. Keep in mind the best thing you can do as an educator is to role model these skills and then allow the child to have a go. With 3 to 6-year-olds, they can help pack their own bag with essential items like their hat and water bottle. They can explore cooking skills and assist in preparing food. They can help set the table, explore the concept of making a bed, and put on their own shoes and jackets, hats and sunscreen before going outside. For children 6 years and over, they can dress and groom themselves completely, prepare simple meals such as sandwiches, take care and be responsible for their own belongings, choose what activities they want to engage in, and assist in setting up and packing away. Enjoy the responsibilities of practical tasks such as gardening or washing a car. So as much as possible, incorporate these into the daily routine and give children independence. On the next slide here, I've got some really great reflective questions that you can ask yourself as an educator. These questions move the focus away from the child's limitations and more on their personality and abilities. So have a think and go back to these in your own time and really think about these and relate them back to your practice. So when is the child most at ease and most comfortable? What makes the child smile? What does the child do well? When do they feel a sense of accomplishment? What does the child like to talk about? And what do they gravitate towards during unstructured play? Such as what do they draw? What do they dress up as? What do they create, build and paint? This will really show you what their strengths and interests are. When do they appear most confident? And how does the presence of other people influence their behaviour? Do some people make them feel more shy? Do the presence of other people make them feel more confident? So these are great questions if you're planning for a child with additional needs. These are great reflective questions to consider to help you design that program. Benefits to educators working with children with complex needs. It can be really rewarding and also very challenging. It can be a great way to develop professional skills and knowledge, develop bonds with families, and provide opportunity to network with other professionals involved in the child's care. Differences should be recognised and valued. Avoid labelling or stereotyping and never refer to the child by their disability. As an early childhood educator, you play an imperative role in demonstrating positive interactions with children who have complex needs. Like with any programming, your main focus should be on strengths and developmental areas of need. So let's recap some of the essential points we've looked at today. We want to work with families and specialists to support the child's specific needs, including social, emotional and physical development and how these can be supported. Respect and accept the child for who they are. See the child, not just their needs or disability. Take the time to get to know the child's strengths and interests and plan for these in your program. Adapt your expectations to meet the abilities of the child. In a sensitive way, help other adults to understand how to best provide for the child and share your professional observations. So don't forget you are a professional educator and you should use this with the families. Acknowledge and uphold your families and children's rights to confidentiality. Ensure there is regular two-way communication about the child's progress and experiences, as well as any concerns or issues that arise. Always use the correct terminology, and remember, no two children are the same. Even if you have cared for a child with the same condition before, do not expect the same outcomes from the same diagnosis. All children are unique and are on their own learning journey. To finish off today's session, we also have some great websites here, resources for educators. These online stores have a great range of educational resources for children with a range of developmental delays or additional needs. I encourage you to have a look at these in your own time, and you could even refer these on to families or other professionals. Thank you for joining us for today's session, and we hope you have gained a lot. Thank you.